Pressure mounting on Sebelius. Help us understand. You're here in New York today. Usually you're in Washington. So impart your insight. What's it like for her down there in Washington right now?
It's tough. She's become the face of this. She's become the target. Look, Republicans were very frustrated during the shutdown and debt ceiling battle that everybody was focused on that and not the kind of, as you said, disastrous rollout of the exchange system. Now they can focus on that. Kathleen Sebelius is who they're looking at. They're bringing her up to testify. She's going to get the full treatment. What Eric Holder has gotten at times as Attorney General, what other administration have gotten at times, she's going to get that now. She is the target, and I think if you talk to Republican lawmakers and aides, they feel like she's the one that they can create as the fall guy as they continue to try and batter away this law.
Are there some basic things here, Phil, that were overlooked, such as somebody going through and running a trial on the website, right, so that they knew it would work and that they knew it could be seamless for people?
The basic blocking and tackling on releasing something like this simply was not done. It was up to a week before. They were not beta testing this stuff. They had not run through the entire consumer experience. It's one of those things that has people at the White House shaking their heads thinking, how did this actually happen? Who didn't tell us what was going on right now? I think there's a lot of frustration at the White House. They thought they could pivot off what happened over the last 3 weeks and really take a positive stance forward. This has taken them back. They're in a bunker mentality right now.
Yeah, it's got to be amazingly frustrating.
Amazing.
And now the president is drafting a top advisor to try and oversee this.
Jeff Zients, right?
That's right. Jeff Zients, who in January is going to take over for Gene Sperling as the National Economic Council Director. He's been brought in. He will be advising HHS, obviously a big health care background. He will be advising them as they try and fix the issues, not only with the website, but also underlying problems with the exchange that they've discovered as 19 million individual users have come to this site over the last couple of weeks.
You know, and the other company here anyway, the company that's come under fire is CGI. It's been the most visible face of Obamacare exchange failures here. Megan Hughes joining us right now. I know you've been taking a pretty close look at the latest developments on fixing this site. What is CGI's role in all this?
Well, Trish, you know, the White House said that they're bringing in the A-team from CGI. You have to ask the question, wasn't the A-team working on this the whole time? But CGI, the biggest tech company in Canada, it actually eclipsed BlackBerry this year. It says it's the 5th largest IT company in the world, and it's gotten a lot of federal contracts. It's U.S. subsidiary, headquartered in Fairfax, Virginia. It is the main contractor on the healthcare rollout. So that's why it's getting a lot of scrutiny right now. And if you take a look at the money that this company has gotten, Bloomberg government actually has some pretty interesting numbers. A preliminary review shows that since the president signed the healthcare law in March of 2010 to the end of last month, the company has been awarded in total $422 million for work tied to the law, not just for the exchange, but that's the whole ball of wax. But here's the kicker. More than a third, or almost $150 million of that money, came in since March 31st, so in the last 6 months. So one sign of the government's last-minute rush to complete the work on this site. And it isn't just CGI. Actually, according to Bloomberg's preliminary number crunching, if you take a look at all of it, the big picture funding for the top 10 federal exchange contractors, generally the big spend has been in the last 6 months.
You have said two things. First of all, that ultimately this is owned by a Canadian company. How curious that the American healthcare network is being designed by a Canadian company. Point number one. And point number two, you just said it, 6 months. Were they under the gun without enough time to actually make this thing work?
You know, people that have been working on it, that are familiar with this work, have said they didn't do the testing. So that there's that. And then we're expecting to hear from a representative from CGI at one of the first of the hearings looking at all of this and what went wrong. That's on Thursday, so we'll get a lot more answers then.